Does your low back hurt when you walk, twist, or get out of a chair? That nagging pain might not be your spine. It could be your SI joint, and you do not need surgery to fix it. Hello, this is Dr. Siddharth Amber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, autoimmune arthritis, regenerative medicine, and metabolic health. My goal is to help you move better, feel stronger, and live pain-free with smarter, lower-risk treatments that actually work. Today, we're talking about a very common and under-recognized source of lower back and pelvic pain, an SI joint sprain. This is the kind of pain that might show up when you're trying to get out of your car, or when you're pushing through a long walk, or even after standing for too long. And what's tricky is that most people do not realize it's coming from their sacroiliac joint, not their spine or hip. The SI joint, when it's unstable, inflamed, or injured, can cause big disruption in your life. The good news is we do not need to jump to surgery or chronic painkillers. We can actually fix the root of the problem using safer and smarter treatments, starting with understanding how this happens in the first place. The sacroiliac joint, or the SI joint, is at the base of your spine. It's where the large pelvic bone called the ilium connects to the sacrum. You've got two of these joints, one on each side of your lower back, right near the dimples above your buttocks. These joints are designed for stability, not big movement, but they play a critical role in how weight, force, and motion transfer from your torso to your legs. So whether you're walking, running, sitting, lifting, or even just balancing on one leg, your SI joints are constantly at work. They're supported by a dense network of ligaments and surrounded by key muscles, like the glutes and core stabilizers. When those ligaments get overstretched or injured, you can develop a condition we call an SI joint sprain or SI joint dysfunction. An SI sprain occurs when the ligaments that stabilize a joint get stretched, irritated, or even micro-torn. This creates instability, meaning the joint moves just a little bit more than it should. That extra movement leads to irritation, inflammation, muscle tension, and pain. Let's go through some real-life examples of when and how this happens. Number one is the pickleball player lunging for a low shot. This is more common than you think. Imagine a weekend warrior in their 50s or 60s who's recently taken up pickleball. It's fun, social, and competitive, but it also involves lots of lateral motion, quick pivots, and sudden lunges. If you reach low to return a shot, especially twisting through the hips and pelvis, you can overstretch the SI joint ligaments on one side. After your game, you might feel a sharp ache in one side of the lower back or buttock. You may think it's muscle soreness, but it lingers for days or a couple of weeks. That's a classic example of how a seemingly minor motion can trigger an SI sprain. Heavy lifting is another big cause. If your job or recreational activity involves lifting, bending, twisting, or carrying weight for hours on end, your SI joints are under repetitive stress. Every time you hoist a box or carry a load unevenly, the ligaments around the joint can get worn down. Over time, that can lead to chronic microtrauma and ligament laxity. You may not remember a specific injury. It just slowly builds up and suddenly your back feels weak, sore, or like it might give out. That's instability. Pregnancy is also a well-known risk factor for SI joint issues. During pregnancy, a hormone called relaxin softens the ligaments in your pelvis to allow for childbirth. That's a normal part of the process, but it also leaves the SI joint more vulnerable to strains and injury, especially in the months after delivery, when you're lifting your baby, carrying a car seat, or pushing a stroller. For some women, the ligaments never quite tighten back up. They're left with subtle instability that can lead to recurring pain for months or years. Often they're told it's just back pain from having kids, but it's really SI dysfunction. Number four is sedentary lifestyle and poor posture. Here's one that surprises people. Even if you're not super active, prolonged sitting, especially in poor posture, can overload the SI joints. Think about sitting slouched with one leg crossed over the other for hours a day. That uneven loading gradually stresses the joint and surrounding ligaments. Over time, this kind of chronic postural stress can create the same instability as a bigger injury. So how do you know if this is what's causing your pain? In particular, how do we differentiate an SI joint related pain from, let's say, hip arthritis or lower back issues? Pain in the buttock or just pain off to one side of the lower back is a classic SI joint sort of presentation. The pain may radiate slightly into the groin or outer hip, but usually not all the way down the leg like sciatica. It's typically worse with standing, walking, or getting out of a chair. Sitting for too long can also make it worse. You might feel like your pelvis is out of alignment or the leg on one side feels heavier than the other. Some people describe it as a dull ache. Others feel sharp stabs with motion. If that's familiar, it's worth checking whether this could be SI dysfunction. Examination can also be a key element when it comes to diagnosing whether it's your SI joint or some other area. In particular, if your hip joint is moving okay without pain, it's likely your pain is not coming from the hip joint. Other subtle neurologic testing can help tell if you have a pinched nerve rather than SI joint pain. And then there is specific testing for the SI joint that can also tell whether the SI joint is unstable and triggering your pain. So let's discuss a little bit more about what's really causing the pain. I always start by identifying the root cause of pain because it's not always the same for everyone. In SI sprains, there are three main issues that can be going on. Number one is inflammation. The joint can become irritated and swollen due to instability. This can happen after overuse or trauma. It's usually tender to touch and movement makes it worse. Instability is the big issue. The ligaments are stretched or weak and now the joint is a little too loose. This creates stress with every step you take and the body compensates with muscle tightness and poor posture. Then there's neurologic dysfunction. Sometimes the problem is in how the muscles fire and stabilize the joint. If the glutes are not engaged properly, or if there's asymmetry in the pelvis or spine, the SI joint can pay the price. The key is understanding which of these are affecting you because treatment needs to be personalized based on what's really driving your problem. You can't fix what you cannot see, so we start with an accurate diagnosis. Chicago Arthritis, we really try to utilize all of our tools to look for instability. Diagnostic musculoskeletal ultrasound is one that can be very helpful to look for joint instability and ligament issues. We'll sometimes utilize that for the SI joint as well. In addition, these kind of instability findings typically don't show up very well on x-rays or even MRI. In addition, we'll definitely do a very thorough physical exam, including palpation of the SI joint, movement tests that stress the joint, core and glute strength evaluation, and functional testing like one-legged standing. When you combine a history, exam, and some imaging, you can typically make a confident diagnosis and avoid wasted time and misdiagnosis. Before we consider injections or procedures, we start with low-risk options that help most people improve. To begin with corrective exercises, we focus on glute activation, core strengthening, and hip mobility. Think of this as retraining your body to support the joint. We also address asymmetries that could be contributing to uneven stress. Postural correction, avoid slouching, leg crossing, or standing with all your weight on one hip. Sleep position can matter. Slide sleepers should use a pillow between their knees to help stabilize the joint as well. An SI belt, this is a supportive brace worn around the hips that helps temporarily stabilize the joint. It's not a cure, but it gives relief when you're rehabbing. Anti-inflammatory supplements like omega-3s, turmeric, glucosamine, even magnesium, collagen are all low-risk options to reduce inflammation and support tissue healing. This phase can be enough for many people, especially if the injury is recent or mild. If conservative care is not enough, we have non-surgical injection options that help your body heal itself without damaging the tissue like steroids do. Prolotherapy is a sugar-based solution, is injected into the weak ligaments around the joint. This creates a mild inflammatory response that triggers the body to repair and tighten the ligaments. This is great for mild to moderate instability. Next, we've got platelet-rich plasma or PRP. We draw your blood, concentrate your platelets, and inject it into the injured areas. Platelets are full of growth factors that stimulate healing, reduce inflammation long-term, and rebuild soft tissue. PRP is more powerful than prolotherapy and ideal for more chronic cases. Next, there's bone marrow stem cells. For more severe cases, we may use your own bone marrow cells harvested from the pelvis to promote deeper healing. These cells are stronger and generally reserved for long-standing or stubborn injuries. All of these treatments are image-guided with either ultrasound or X-ray guidance to ensure we are hitting the exact tissues that need repair and healing. Why do we recommend avoiding steroids and surgery? Let's be honest. Steroids are a quick fix, but they're not a long-term solution. They reduce inflammation short-term, but they weaken the connective tissue over time. That makes the joint more unstable and you end up worse off. As for surgery, SI joint fusion is a last resort. It involves screws and metal hardware to fuse the joint. That sacrifices motion and function, often with only modest pain relief. Instead, we want to restore stability and function naturally. Let's discuss some cases of real patients. Number one is a 39-year-old yoga instructor came to see me after struggling with right-sided low back pain and SI pain for 18 months. She tried massage, physical therapy, and even 2 steroid injections with only temporary pain relief. On exam, we found subtle instability in the ligaments around her right SI joint. We started with prolotherapy treatment. After 2 monthly treatments, she felt 40% better. After 2 more treatments, by the 4-month mark, she was back to teaching full classes without pain. And this is what's possible when you treat the root cause and avoid masking the problem. Case number 2 is my own mother. She started to develop right hip pain after giving birth to me and then my brother 3 years later. This is a few decades ago. Initially, this was thought to be coming from her lower back. Her pains persisted despite exercise and rest. After a proper examination, some imaging, we ended up deciding that a large portion of her pain was actually coming from her right SI joint. We pursued PRP treatment into her right SI joint and the SI ligaments on both sides of her pelvis. After 2 months, she was back to full activity without pain, and her chronic right hip pain that she had for decades was over 80% resolved. She's done very well with treatment over the last decade, and we have essentially repeated treatment for her every 4 to 5 years, and she's done great for this period of time now. Let's discuss some common myths related to SI strains. Number one is, I just need to stretch more. Actually, most SI issues are due to weakness, not tightness. Stretching may feel good, keeping the range of motion in your hips is important, but stability is the real issue and the real solution. Number two is, it's just part of aging. That's incorrect. SI joint pain is treatable at any age if you target the root cause. Saying that something is just expected as we age is not the right way to approach things. We can still improve things, maximize your life and your function, and reduce your pain so that you have a much better quality of life. Number three is, if I get an MRI, I'll know for sure. MRIs often miss ligament laxity. A good exam, and in the right cases, ultrasound are far more helpful. MRIs are helpful if you're looking for SI joint inflammation or you need to evaluate the lumbar spine. To sum it all up, SI joint sprains are incredibly common, but they don't have to become long-term issues. When you understand that pain comes from instability, inflammation, or poor neuromuscular control, we can treat it effectively. With personalized care, that starts conservatively and escalates when needed. You can avoid surgery and get back to living fully. If this video helped you, please give it a thumbs up, subscribe, and share it with someone dealing with back or hip pain. And if you're struggling with SI joint pain, visit us at chicagoarthritis.com and contact us to schedule a consultation. We're here to help you move better and feel stronger. Until we see you next time, have a great day and live well.